How to measure posterior tibial slope. The classical and most widely used method for determining the posterior tibial slope is the measurement relative to the proximal anatomical tibial axis, as described by de Jour and Bonin in 1994. For this method, the center of the proximal tibia is defined using the centers of two circles. The first circle is placed just below the tibial tuberosity, or approximately 5 cm distal, to the tibial plateau. The center of the second circle is located approximately 15 cm distal to the joint line. A line connecting the centers of these two circles defines the proximal anatomical tibial axis. The posterior tibial slope is then measured as the angle between a line perpendicular to the proximal anatomical tibial axis and a tangent drawn along the medial tibial plateau. Most published studies investigating the effect of tibial slope on knee stability have used this measurement method. In cases of a bowed tibia, however, the posterior tibial slope measured relative to the anatomical axis may be underestimated. Furthermore, tibial bowing makes determination of the anatomical tibial axis more challenging. For this reason, measurement of the tibial slope relative to the mechanical tibial axis has become increasingly popular. The mechanical tibial axis is determined by connecting the center of the knee joint with the center of the ankle joint. The posterior tibial slope is then measured as the angle between a line perpendicular to the mechanical tibial axis and a tangent to the tibial plateau. In a normally aligned tibia, slope values measured relative to the mechanical axis are approximately 1 degree lower than those measured relative to the anatomical axis. In contrast, in patients with significant tibial bowing, the mechanically measured posterior tibial slope may be substantially greater than the anatomically measured value.